Good evening, ladies and gentlemen. We are Team 14, and we're here to give you our strategy for Meditech Italian expansion. To start off, here's our team with me being Emily and my partners Kyle, Jeannie, and Vivara. Here's our agenda that we're going to quickly go through over. And to start off, the reason why we chose the Italian market was based on a few consumer trends. First being that the EHR market is forecasted to grow at a 6.0% growth rate from 2019 to 2025. This is supported through the government's initial act of SSN, which is the Universal Coverage for All Citizens and Residents Act. This is also supported in 2016 through the NSIS, which is an initiative to establish electronic records at every level of care. Lastly, the last support is through the government spending total, which is increasing from 9.1 to 9.2% of government spending into the healthcare sector. Here we'll have Cal talk about the potential revenue in this market.
Yeah, thanks, Emily. So with an increase in spending and a need for more advanced equipment, the EHR market will need to grow with this as well. According to Ministry of Health and the Digital Italy Agency monitored the process of EHRs in all the regions. 33% growth, 47% are in process, and 19% are not working in certain regions. According to statistics in 2018, its health revenue in Italy reached to 382.4 million USD. And if Meditech capture the potential well in the first year, we can get 11.5 million, and the following year can reach to 26.8 million, and the third year can be 38.2 million. So if the Meditech does mean still have a portion of the market open to be in and differentiate themselves from the rest. Our main goal in this country is to attribute marketing practice from the output of revenue, increase the brand engagement, and try to generate a rate of number of qualified leads. And Barbara will present about method competition.
Thank you. So the overall EHR market in Europe is highly fragmented. As you can see, the majority of the market is owned by different vendors. Engineering, Ingegneria, and Daedalus stand out in particular because those are the two main competitors who only supply the Italian market thus far. Other competitors looking into Italy that support other parts of Europe are AGFA and Cerner. While analyzing Meditech's potential expansion into Italy, we also conducted a SWOT analysis for this market. Let me quickly summarize the key points of the analysis. First of all, Meditech will be among the first market players in the south of Italy and therefore can utilize its first mover advantage. As an opportunity, we see that potential customers in Italy are especially interested in mobile solutions, meaning Meditech could interest them with their smartphone app Expense Patient Care, which allows doctors and nurses complete their tasks through a mobile device. Now let's talk about why Meditech's expansion into the Italian market will be so valuable for all parties involved. First, Meditech's customers, which are the public hospitals in the south of Italy, will be able to improve their service if they implement Meditech's EHR solution. For Meditech itself, the expansion into Italy will constitute the highly anticipated business growth opportunity. Lastly, the authorities in the southern provinces will be able to catch up on the implementation of the federal legislation on health information systems that passed in Italy in 2016. Now over to Emily, who will talk about the differentiation factors.
To start off, there is no software identification at a national level. This is due to the fact that as there's not as much in-depth information that public hospitals can provide since they only provide a limited amount of healthcare. Past the basic amount, there's no extra information or identifier for a patient to have. This is also something that Meditech can look into, whether it be coding or software that they can potentially provide a solution to. Lastly, we wanted to also look into the southern region because it has less advanced medical equipment. 10% of the market belongs to private hospitals, rather 90% belongs to public. And the amount of satisfaction is far different, considering that only 19.6% of the public hospital population is satisfied compared to 42.1%. Due to the economy and history, there is a huge gap that Meditech can go into, perhaps be a connection between the solution. So we provide an example of a public hospital partner that Meditech can look into, which is Pilgrim's Hospital, because it is one of the only few hospitals that provide assistance in all clinical sectors, and other hospitals only provide information on emergency rooms. And they also provide service on operating units in both hospital and outpatient, so both hospital doctors and patients know the information going on. And to further expand into the Italian market, Meditech can look into medical universities, the partner being University of Naples Federico II, because it is one of the only few medical universities that are publicly funded by the government, and also one of the few universities that has the integration of clinical services and medical sciences, considering that as future generations, doctors will need to know how to work with EHR. And here we'll have Ginny look at our marketing strategy.
Okay, thank you, Emily. About the marketing strategy, firstly, we know that Meditech's development in the UK are very smooth and successful. Their experience can be used in the development of Italy, such as we can also have a dedicated team of experienced healthcare professional station to provide sales and support to the private hospitals and other facilities across the region. But unlike the UK starting from a private clinic, we hope to start our business from the public hospitals in Italy. And the next step is to look for the 90% potential EHR markets, as my teammates mentioned before. The sooner we approach these markets, there will be fewer competitors and more advantages for our position. And the next is to develop our services in many aspects to provide our customers, whether doctors or patients, help them have a better diagnosis during their treatment experience. And at present, Meditech already has a very comprehensive service content. Some are very mature and some are still in development stage. But the coverage is already very extensive and even includes some hospice care. But here I would like to propose a new idea about the learning of our EHR system. We can find more partners like MedPower to popularize the learning of our system and even adopt some media methods. On the one hand, it can make the learning path more diversity, and on the other hand, it also kind of promotion of our products. I mean, EHR sometimes can also be very fashionable. And next is for COA.
Thank you, Jenny. So to let managers know if they have made a difference in a hospital, we are three different key indicators. For example, internal is to increase in communication between primary care physician and provider and patient. Operation increase in patient satisfaction and patient follow-up. Emergency room is to decrease in period of patient wait times by process step. There are no exact numbers on growth because each hospital is different and has different number on growth, but this is an overall issue seen in public hospital. And now Emily will conclude this presentation.
So to conclude, with Italy's initiative on universal healthcare, it supports the EHR market. Meditech can partner with public hospitals or medical universities in the southern region to be an exclusive provider and meet their needs. Through innovation and a change in offerings, Meditech can stand up for public hospitals to gain interest in. Entering the Italian market can provide a way to further expand Meditech's presence in the European market. Thank you for listening, and we hope you consider our strategy.